I know, isn't it?
But a lovely part of town too.
Oh, it's absolutely beautiful.
Keep my eye on it.
He abandoned nostalgia strategy.
Oh, you did.
He did.
During the pandemic.
Okay, we're gonna get started, Mayor Mock. Again.
Yeah.
All right, thanks, everybody. We will call.
It's taking a while to get onto YouTube. I apologize for that.
30 seconds.
Okay, I'm gonna start recording if that's okay.
Yeah. Good evening, everybody. Thank you so much for being here at the Santa Clara County Citizens Association Board of Directors meeting. And I will call it to order at 7:15 p.m. And with that, I'll turn it over to our Executive Director to do roll.
Great. Ann Bybee or Sergio Lopez. Sheila Mohan.
Here.
Nisa Flyger.
Here.
Stanley Mock. Matthew Hudes.
Here.
Carmen Montano.
Here.
Javid Elahi.
Present.
Mark Turner or Marilyn Liebers. Nope. Okay. Margaret Abikova or Pat Showalter. Greer Stone or Lydia Trump. Perfect. Rosemary Kamei or Sergio Jimenez. Kathy Watanabe or Kevin Park. Tina Walia.
Here.
Larry Klein.
Here.
Okay, 1, 2, 3, 4, 5. Nine, we have quorum, President.
Thank you, Holly, and thank you all so much for being here. We'll move next to public comments on items not on the agenda. And I think we have a member of the public who would like to introduce herself.
Hi, my name is Donna Strauss, and I'm representing myself and my company, Carmen. And I'm representing cybersecurity, AI, ML, all that good stuff, right? So love to meet you after the meeting, and thank you for having me.
Thanks for being here. Any other public comment on non-agendized items, Shelley?
No.
So then let's move to the agenda, and our first item of business is the consent agenda, and we have two items. It's our minutes from our last meeting on August 8th, which was in Morgan Hill. I wish Mark Turner was here. And also to disband the BAFA, the Bay Area Housing Finance Authority Subcommittee, which Larry, Stan, who else was on the committee, Matthew, and JR Bruin will all tell you it was the most short-lived subcommittee ever. We formed on a Thursday and we disbanded the following week, but we were very productive in that week. So if there are no questions or comments on the consent agenda, I would look to see if there's any public comment. And if not, I'll entertain a motion to approve consent agenda. So
Second for Carmen.
And you can just do a voice
voice
vote.
vote because of the
Motion to approve the consent agenda as presented by Walia, second by Klein. All in favor?
Aye.
Any opposed? Any abstention? No, I'm sorry, I shouldn't have asked for absences. Thank you. Motion passes unanimously.
Thank you, Cheryl. Next, we'll have the president update, and I will start with the BAFA bond and the subcommittee, because I want to share the thanks that I heard from the broader community on the fact that the Citizens Association really took a leadership role in educating elected officials and being partners in educating members of the public about the BAFA bond. As you all should know by now, the BAFA board and the ABAG board decided not to move forward with the bond measure for this year. As your ABAG representative, I know we're having meetings discussing what happens next. If and when are we bringing back a bond, what that will look like. And so a lot is still unknown at this stage, but for various reasons, the boards decided not to move forward with the bond measure in November. But as you know, we were ready to go. We weren't taking a position on it, but we recognized if it passed, this was something that we needed to make sure we were engaged with the county, and we have our county executive, Mr. Williams, here. We wanted to make sure that we would be partners with the county and ensure that our cities would all benefit from this bond measure if it were to pass. So really, thank you all so much for being at the table and being ready to work. We also met with the city managers group. And they appreciated us coming and meeting with them and talking about how we can do this together. And then, of course, that same day we heard the repealing of that measure. But really, thank you all so much for the work we all did together. I see your hand, Javed. I'm going to finish my report and then I'll go to you. And matter of fact, I just have two more things. One, it's the Peninsula Division, the CASCC Peninsula Division. Their next event is on September 25th. It will be in person at Skyline College in San Mateo County. It's a luncheon and it's $25 per person. They're having the Skyline College cafeteria cater the event. And one of the government classes there, which I think has 25 students, they will be attended, and the students are excited to interact and mingle with elected officials. So we're trying to encourage as many elected officials as possible to please attend. Most cities will cover the cost of the lunch. It's $25. So put it on your calendar, September 25th, luncheon, Skyline College. And as you know, we're partners with a lot of things with CASCC, so it'd be great if you can attend. And then the third thing, I joked about Mark Turner not being here, but I do want to thank all the council members and board members who made the trek down to Morgan Hill. Nothing stopped us. We all made it down there and we fulfilled a commitment we made at the beginning of the year that we would have a board meeting in Morgan Hill, and we did it. And I know Mark really appreciated it. So thank you all so much for doing that. And with that, that's my update. That's my president's report. Councilmember Elon.
Yeah, and I didn't make it first off, I think it was a good event in Morgan Hill, and when the traffic going the wrong way, traffic. I just had one comment about the Papa thing. I think that was a good show that we were there. I was very impressed that all the city managers were first. One thing I wanted to leave a comment was that we made that subcommittee to kind of let everybody know what the city association solution was going to be, on how the fund should be divided, what they take it. My thought was that this should be part of the board, we put a bond measure on the ballot. That and then the other measures may not be a buffer bond, but if some other measure comes in where later on it's decided how the money is going to get chopped up later on, we should do it beforehand, get it all on board. We can hash it out amongst ourselves if we're going to get how much, then we're all. I just want to leave that thought.
Thanks for that feedback and comment. I will tell you, as one of the three representatives from Santa Clara County, is myself, Supervisor Chavez, and Councilmember Margaret Abicoga. We advocated for that along with other council members. We were successful with some things, I will tell you. We were very vocal about the fact that Santa Clara County is putting the most in, so we should be getting the most out, which we would have. So we were definitely advocating for things like that. In the end, the board decided to leave it up to each county to work with their individual cities. So as we move forward and we decide what happens next, I wouldn't be surprised if this comes up again, because I think there was a lot of learning between March and when the bond got pulled about, maybe this would have made a difference, right? So this is really great. Thank you. Any public comment on the president's update, Charlie?
No.
Thank you. All right, so next we will move to item number 3. We've been waiting on this item, and so we're very excited to have our county executive, James William, with us as a guest speaker. It's on the paramedic and emergency ambulance services, the rural metro ambulance update from the county. I will read Mr. Williams' bio. I think he knows most of us here, but we like to put it on the record, James, because it's recorded. And just in case there are 1 or 2 people here who aren't familiar with your great work, I'm sure I just do a quick bio. So thank you so much for being here, James. He has held this position since July 2023. As county executive, He is responsible for executive oversight of all administrative affairs of the county government, including overseeing implementation of the board-directed policies and programs, and coordinating the work of all offices and departments of the largest county in Northern California, with an annual operating budget of over $12 billion and more than 23,000 employees. Immediately prior to becoming county executive, James served for 7 years as the county counsel. In this role, James led the county in critical litigation to protect the public interest from unlawful federal actions by the Trump administration on a range of issues. Major impact litigation against manufacturers of opioids and lead. Legal work to ensure the county's success of acquiring O'Connor and St. Louis hospitals out of bankruptcy, and many more. Throughout the entire pandemic, and I think many of us interacted with James or saw him on the press conferences where we're getting daily updates on what was happening in the county. He served as the director of the county's EOC, where he played a key role in the operational response decisions for the county. He began his career with the county in 2010 as a social justice and impact litigation fellow in the county counsel's office. I remember that well. Shortly thereafter, he became deputy county counsel, working on a number of finance and taxation matters. He later served, starting in January 2013, as the deputy county executive, where he provided oversight of several critical departments and program areas such as the Office of Emergency Services, Procurement, County Fire, and the 911 County Communications. James received his JD, yes, he's another attorney, from Stanford Law School. He graduated summa cum laude from Princeton University with an AB in Public and International Affairs. He received numerous recognition and honors from Princeton University's highest undergrad distinction. He's a Harry S. Truman Scholar and a Paul Daisy Soros Fellow. James, thank you. I think it's just one page. Thank you for being here. And with that, I will turn it over to you. As I said at the beginning, you can sit there, you can use the podium, whatever makes you comfortable. I don't know if you're sharing slides, but Charlie can help with that.
Well, thank you all so very much for inviting me here, and thank you, Nisa, for reading that biography. I do know many of you, but not all of you. And it's a real pleasure to be here. It's been probably about, gosh, I want to say about probably 9 years since I last attended the Cities Association meeting. So I'm happy to be here. I want to also introduce, before I start, Nick Clay, who is our county's new EMS director. He started about 6 weeks ago with the county. He joined us from Santa Barbara County. We're delighted to have him on board, and I asked him to come and join so that he could hear the questions and conversation that we have as we continue to work on our emergency medical services system. I don't have slides for you today. What I thought I would do is take a couple minutes to talk about where we're at right now as a system, a little bit of history. I know some of you know some of that history, but I think it's a good grounding to have, and then really open it up for an opportunity for folks to ask questions about kind of where we're at and where things are going. So let me start with a little bit of kind of the history and then talk about some of the challenges we're dealing with right now as an EMS system. We last did a significant system change in Santa Clara County for emergency medical services back in 2011. And there was the last major RFP that resulted in a shift in providers from what was then AMR as the main private ambulance provider to Rural Metro, coming in as a new ambulance provider for Santa Clara County. That contract, like most contracts across the country, certainly in urban areas, was 100% exclusive, advanced life support based emergency response contract. And it was based on, of course, the data that was available at that time, and was a very favorable contract for our community on basically every front. And it was such a favorable contract because Rural Metro was trying to compete to enter the market here. So we got, for example, the lowest rates in the entire Bay Area by a very big margin. We got very strong financial performance incentives. We got in that contract very strong liquidated damages provisions and very significant response time and other commitments from rural metro. That was 2011. Since that time, a lot has happened. For one thing, AMR bought out rural metro. So rural metro disappeared, and we ended up with AMR again once again as the provider. There's also been a real series of changes in the EMS ambulance response landscape in the intervening years. One big change is that call volumes have risen dramatically, especially since the post-pandemic period. So the number of calls and responses has gone up by about 150% since that initial contract. In addition, there've been a whole variety of changes in the billing landscape that have occurred, including related to balance billing, which is the practice that, where, if an insurance company paid X amount and there was still, the bill was higher than that, you could bill the additional amount to, in the case of an ambulance, the person you're transporting, but in the case of medical services generally, right? I think we're all familiar with some history of that in our own lives, of, getting a balance billed for example, out of network or other coverage. California has adopted, different regulations to prohibit that. Lots of other changes in kind of response and service delivery. And we've struggled over the years, as you all, I think, are well aware, with the performance of the system for a variety of reasons. Most significantly, since the pandemic itself, with a shortage of paramedics. And that's significant because in order for a unit to qualify as an ALS or advanced life support unit, it has to be staffed with at least one paramedic. So the staffing for an ALS unit is 2 individuals, you have 1 paramedic, 1 EMT. And so a shortage of paramedics affects the availability of being able to staff an ALS unit. Over the years, the county has done a variety of things. There was an RFP process. I get the year wrong. I think it was 2018. There was an RFP process that was basically a failed RFP. There were no other bidders. There have been changes to the contract structure over time to reflect kind of the changes in call volumes that have occurred. And there's been a number of other things that have happened. So for example, one of the big system challenges that the system's facing is something called wall time, or ambulance offload time, AOT, which is basically the amount of time a unit is stuck at a hospital, and sometimes hours when a unit is stuck at a hospital waiting for an emergency department to be able to take that patient in. That's a function of the volumes in the emergency departments in the county. And so the county's expectation or goal, threshold goal for ambulance offload times is 20 minutes. And basically every hospital in the county is regularly exceeding that, sometimes by very significant orders of magnitude. And again, that's a reflection of how affected and impacted in terms of volumes post-pandemic in particular those emergency departments are. Some from ambulance traffic, but largely walking traffic. We are in the process today of doing a system-wide assessment. And what I mean by that is we need to look at how our EMS system works for today, given the call volumes that we have, and given the changes that have happened across California and nationally, where we want to make sure we've got the right unit coming at the right time, given the level of acuity or need. So I'll give you a couple examples of some things that we're beginning to pilot in our system to get data that we will then be able to use for the next iteration of what the EMS system will look like. One example is the introduction of BLS units, this is basic life support units. Those are units that physically look the same vehicle, with the same equipment, but is staffed by 2 EMTs instead of an EMT and a paramedic. Not appropriate for the highest acuity calls, but certainly appropriate for a significant subset. We estimate probably about a quarter of the call volume across the county. In addition to that, we're excited that we will be soon launching a pilot for those jurisdictions that are directly served for fire response with dispatch through county communications with a nurse navigation program. What that program is for those small percentage of calls, but I think we all know that they exist, that don't merit a transport response at all. These are calls that are really not 911 calls, but calls where somebody needs assistance getting connected to an appropriate medical resource. And there'll be a nurse triage line that's basically operated in the call, diverted out from the EMS system altogether. We think, but we'll see, we need to gather the data. This might be around 5% of the call volume. Now, those may sound like really low numbers, but the net impact of looking at some of these things, the system is how do we then appropriately utilize the higher level of resource and ALS transport resource so that we're having appropriate response times, but also unit availability, which has been one of the challenges in the last couple of years with the paramedic shortage that we faced. Separate from that, we've pushed AMR very hard to address the underlying pipeline of paramedics coming in the system. And they've done a number of things based on our pressure. One is they've contracted with some private providers to add some ALS coverage. Second, they've moved some units from other counties across the Bay Area, given the increased call volume here. And third, they've invested in their rates. So they have represented, and we believe this is true, that they now pay the highest per hour for paramedics in Santa Clara County, the highest rate that they pay anywhere in the United States. And fourth, that they've invested in the pipeline of folks training up from EMT to paramedic status. So those are all steps. That fourth step, of course, is the most critical, but also the one that takes the longest, right, to yield results. But our goal with that is to get to an appropriate level of ALS units in the system that can be available at all times to respond to calls versus the situation that we've had in the wake of the pandemic with high call volumes, where there are times where there's not been units, ALS units certainly available to respond to calls. We're hoping through all of these various efforts, not just to stabilize the kind of current picture countywide, but more importantly, gather some really useful data that we can then use to help inform whatever the next iteration happens to be of an RFP or whatever else for the next version of EMS system, whether that's a continued contract with a private provider or something else. But having a different model, we all think, is going to be critical going forward, given the call volumes that we now see in Santa Clara County if they continue their trend post-pandemic, and if the emergency departments continue to be so severely impacted. And that most recent trend is not abating. I'll tell you that certainly for the county's own 3 hospitals, our patient census is the highest it's been, and all 3 of those hospitals are full. Which, when we acquired O'Connor and St. Louis out of bankruptcy, those hospitals were very empty. The average daily census down in Gilroy was running around 20, and today is running around 60. And it's all those facilities, BMC, O'Connor, and St. Louis are full, but the other hospitals in our community are heavily impacted as well. So we did extend, the board authorized an extension of the contract with AMR in the spring. I forget exactly what month now, but think it was March that the vote was. The board authorized the extension of the contract. We're hoping to get some of these things in place and you have the data then that we can utilize, both for the system analysis, but also, like I said, to be able to put something out for, for an RFP or whatever else is coming to. At the same time, we are looking to retain a consultant to help do outreach with stakeholders on a system-wide assessment for EMS, including looking at some of the different kinds of models that have been employed throughout California. There's a bunch of different models that have popped up over the last decade in the state. Many of those models are the subject of uncertain regulation and legal challenges. So several of them have pending court cases. Santa Barbara, which Nick is familiar with, but can't directly talk about given the litigation issues, is one that's currently in litigation where the court actually issued an injunction. So we're closely monitoring that. And we're also closely awaiting some new regulations from CALCC, which is the state EMS authority, and under whose regulations we have to abide. There were a series of kind of guidance that they had previously issued that was tossed out due to some legal challenges as so-called underground regulations, and they've been taking their time, but supposedly comprehensive, officially promulgated regulations subject to the whole notice comment and the full process are supposed to be forthcoming. They'll help define what the process looks like with us. We're very well aware of challenges in different parts of the county. I know we don't have, I think, I'm looking around the room, I'm not seeing South County representation here tonight, but I know, for example, and we're quite aware that probably of all parts of the county, the system availability challenges are most acute in South County, given the much longer geographic distances that affect response times down there. And the fact that some of the fire service down there is more stretched thin compared to other parts of the county, both the South County Fire District, which is a county dependent district, but also in particular Gilroy Fire Department is very stretched thin. So we're very well aware of that. And we're also well aware that there's a variety of other challenges faced throughout the county. So we will continue to push AMR for responsiveness and compliance with their contractual obligations. We're continuing to experiment with ways to triage in the system in an appropriate manner that frees up as many ALS units as possible for ALS level response where it's needed. And we're going to continue to do a comprehensive assessment so that we can kind of figure out the best path forward so we have a sustainable system in the future. But one of the things that I think is a bit of a lesson learned coming out of the 2011 contract is, we got such an incredible contract paper. If you actually look at that document, the original 2011 contract, it was unbelievable. But it wasn't something that was operationally deliverable. And so from day one, rural Metro couldn't do what they had promised to do, and they made promises to try to break into the market. And that's all well and good, and it's nice to collect liquidated damages, but the point of the system isn't to collect liquidated damages. The point of the system is to deliver service, right? My goal would be we have zero liquidated damages, and that we have a system that is meeting full performance expectations. And I think making sure that we've appropriately calibrated the system as a whole and appropriately calibrated the levels of response is a way to ensure that we can sustainably do that. So I'll pause there. I'm sure folks have a bunch of questions. I don't want to continue talking about EMS. As you can tell, I've gotten in some of the weeds on the system, but happy to answer any questions.
I'm sure there are a lot of questions, James, and if we have time after questions and comments from board members, we also would love to hear what's happening in the county in addition to this.
Yeah, I'd actually love to take you up on that and just share a couple minutes with all of you about regional and a couple of the other things going on that are really big for the county.
So a couple of things. One, I know you appreciate knowing who else is in the room, so I really need to introduce myself to city manager to your left, England. He supports the board this year. And then Thomas, who is the city manager from Milpitas, he walked in. There he is. And then, of course, you know Steve, who does an amazing job for the county. Thank you so much for sharing him with us on a multiple basis. Amazing.
I'm delighted but not surprised to hear that.
And I will add too that we're a very action-oriented board. And so what we'll look to you and your team at the end to tell us is how can we partner with you? How can we help you make the contract moving forward even better for communities? You mentioned the extension that the board approved in spring. What's the term of that extension? Do you know?
Yeah, so it was, the core extension was an 18-month extension, but it has additional options. And, you know, the reality is, nobody wants to hear this, but the reality is some of those options will end up getting exercised. Hopefully not all of them, but yeah, even if we had a new RFP out in the street right now, and we can't put one on the street without not only developing it, but getting state approval for 6 months on its own. State has to approve any of those. You have to have transition time, right? So if you were, unless you were keeping the exact same provider with the same structure, you have to have operational transition. So, so we've tried to build out all that in, but we need to have some of this data in order for people to be in a position to even bid for service. So if we're shifting to a model that's a multi-tiered response model, which we think we have to have as a community, given the call volumes, and the fact that you couldn't meet that full volume with only ALS units, there's just not enough paramedics to go around. We have to have the data so people can intelligently bid. So that's why we're working real hard to get those pilots through to get that data.
Thank you. Okay, get us started, Matthew.
Thanks. I'm not sure if this is an appropriate question. I have a framework for EMS from the East Coast where I grew up, where it's typically provided by a public service agency or a government agency. And so the question that I had when I saw this was on the agenda is about disaster preparedness. And is that part of the contract, participation in drills, particularly on the communication side? I personally participate in drills with the county and through CERT and through our local area. And I think that is an increasing requirement for all of our responders of any kind to be to test out our communications and to test out our emergency preparedness.
100%. So we do have very significant disaster preparedness and response provisions in the contract. And on this front, there's definitely been compliance issues, like I said, since 2011. But on this front, AMR has actually been pretty good. All the dispatch is done through county communications, so that's done by the county. AMR has contractual requirements in terms of having surge capacity. And one of the advantages, there's certainly disadvantages for sure, but one advantage of having a large private provider is the ability to surge into the county from adjacent areas if there's a mass casualties. But we've had really good responsiveness for, major events. I used to directly oversee our Office of Emergency Management. I was the EOC director, for example, during Super Bowl 50. Lots of additional units and resources were brought in to Santa Clara County geographically for that event and other similar events. And those are provisions that are mandated in the contract. So it is a whole separate set of criteria and is something's very important. And there's good integration with the rest of the response. And that happened also very effectively during COVID. Thank you.
Yeah.
Thank you for giving us that overview. Something struck me when you said the call volume has increased about 150% since COVID. So two thoughts come to my mind. How far ago, and I'm not looking for just an overall sense. When did we have that kind of surge happen in the past? And really, the bigger question in my mind is the population in the county has not increased. So when you said even the non-county hospitals, is there a split that we're talking 3 county hospitals, patients for those 3 hospitals, or is it just overall?
No, this is overall. So just to clarify, the 150%, that's since the 2011 timeframe, not since COVID. There has been a surge since COVID. So there's been a particular uptick since COVID. The impacts we're seeing are system-wide. I was giving the county hospitals as an example because I know I get their census every day, which has huge impacts on our operations and revenue. And so I was using that specific data, but Kaiser is impacted, El Camino is impacted, El Sam is impacted. So it's not just a county hospital situation for the emergency departments. We don't really know exactly why there's so much more utilization since COVID. It's an interesting question. The initial spike, the theory was, well, this is deferred healthcare from people who were avoiding going to the doctor during COVID because they didn't want to get COVID or all the other reasons, right? And all the procedures that early on, right, were all elective procedures in 2020 that were canceled. But that doesn't explain why here we are in 2024 still seeing these extraordinary volumes. Because that normalization should have happened a couple of years ago. And it's a question that people don't really know, but we're seeing it all over the place, right? So we're seeing it in utilization on the health insurance side. We're seeing it in utilization and access for primary care, specialty care. We're absolutely seeing it in the emergency departments, and we're seeing it in the 911 system. But it's not that there's any particular spike in, car accidents or something like that. So it's a bit of an unexplained thing, but it's one of the big drivers right now of the huge increase in healthcare costs. And I'm sure all your jurisdictions have noticed really major increases the last few years in health insurance rates. And that's primarily being driven by utilization. So it's happening across the board, but one piece of that is the 911 system and one adjacent piece of the emergency department.
Aging population and more awareness of not delaying stuff, not to have a conversation.
Yeah, I mean, there's a lot of theories, right? I mean, there's, it is an aging population. There's people think that maybe people are more acute and concerned about physical health. So there's a lot of factors, but you're right, our population overall has been flat. And there isn't any clear external factor. There's not like some spike in certain illness or something. I mean, the numbers we're seeing today, for example, we're not in, the COVID spike from the summer has come down, flu season hasn't hit yet. Normally we peak right around the very end of the year, like the last week of the calendar. But right now the system is, EDs are full. So.
Larry and then John.
Sure. So several things. First, Sunnyvale is pretty unique about our merged public safety model. So thank you for the county for getting additional paramedics within the city to deal with the lack of a certain amount of paramedic services. Let's go back. I look forward to hearing what are when did this data come back from that program?
Well, program hasn't launched yet, so it's been a lot of work to put together. It's starting with so we have 6 centers that do emergency medical triage. in our county. The largest is of course San Jose, but the second largest is county communications, and we're starting there because we can tell them to do it, right? And then we're gonna come, and then if it's a successful pilot, right, so we're hoping it'll launch, by the end of November. We'll collect data. We need to make sure it works, right? We're not gonna roll out a system that sends somebody nurse navigation who's having a heart attack, right? That would be very bad. So I make sure it's working right. And then you'll hear from us that we're gonna come knocking on the doors of the folks who have the other centers, if it's working well, to invite you to join and expand that program across the rest of the county. But it's dependent on doing EMD. And I want to highlight that because one of the system impacts that we have is several of our dispatch centers today have a very low percentage of calls that they're triaging. In other words, they get a medical call and they just send code 3 without determining whether it needs a code 3 response because it's a heart attack or whatever, or somebody broke their finger and you don't need to send the lights and sirens code 3 response, or you maybe don't need to send anything, right? And that's the whole point of doing that triaging with the dispatcher, where they ask, it's a pretty quick process. It's usually 30 to 60 seconds. So it's very quick. They ask a few critical questions and they can then appropriately code the call. But they're obviously, at any dispatch center, there's a lot of bypass. But there's call volume, whatever, they can bypass and just send code 3. We have several centers in our county where a majority of the calls are just bypassed and they're just going code 3. And that's a real problem for the whole system, because that's treating that the same as a heart attack call. And we understand that there's staffing challenges at dispatch centers, but it has this ripple effect. So, nurse navigation is only as good as the percentage of calls that are even bothering to be triaged. And so one of the things we need to work on collectively, and you were asking about, action steps. One of the things that I would ask of everyone in terms of how we can do better as an entire community is if we can get all 6 of these centers to actually triage a higher percentage of their calls. We know it won't be 100, right? There'll be somebody who can't talk, for example, they can't triage the call, right? But to get a much, much higher percentage of calls triaged will help the entire system by not inadvertently sending units. And that's good for everyone.
So quick follow-up, a lot of the problem is paramedics not being able to offload. Emergency centers backed up. There's a lack of urgent care around the county. And so I've talked to Supervisor Lee on this. You have lots of health centers that are 9 to 5. Is there a possibility to start propping up urgent cares at the health center? Understanding that there's hospitals with emergency rooms and all that, but because there's not urgent care, if there's a problem that could conceivably be urgent care, and there are private urgent care systems around the county, but the majority of people will say, okay, I'm just going to go to the emergency room since there isn't urgent care there. Is that a possibility that
Yeah, we're definitely looking at how for our own clinics, we have 14 clinics, how we can expand after hours and other access. One part of our hope with the acquisition of Regional Medical Center, for example, is to be able to expand access and services, including clinical services in addition to hospital services. There's really significant access challenges across public and private systems, as many of you probably know from your own life experiences. But access to primary care doctors is a challenge, and that's impacting hours of operation. Because doctors have a lot of choice right now when they want to work because of the and just as we see in all professions right now with younger generations, there's a different emphasis on work-life balance. that steers away from folks necessarily wanting to provide the robust coverage on weekends or nights or evenings. So there's a real workforce challenge on the paramedic side is one, but it's also there on the physician side as well. And that's true for both specialists and primary care, but the primary care piece impacts things like urgent care too. So we pay, the top like 150 highest paid county employees are all physicians. They're all like way ahead of me. And yet, we have challenges with physician recruitment, and the private systems do too. And then have challenges with getting folks to take certain shifts and coverage. So it's a multi-layered challenge. That's one.
I'm just trying to see if there's ways to prop up that, because it's going farther up the stream.
Yeah.
Because we can do whatever we want with paramedic services, and there'll be a shortage of, of vehicles or paramedics, but trying to make sure that people aren't going to emergency rooms, which not only causes that balance.
Well, it causes increases in cost, huge increases in cost, and we want in an ideal system, right? We're getting people the right level of care at the right time, which means preventative care, right? In the first instance, but you don't want people going to the emergency department who don't need to, because then they're getting in the way of people who might need that care. You won't want people going to urgent care who candidly should be going and getting a regular appointment, but they're in urgent care because they can't get in. I was at an urgent care myself the other day. I was in broke my toe several weeks ago, and there were people coming in the door, and who there's one person who came in and said, I've got a little bump on my head that I've had for 5 or 6 months, and I thought maybe I should just get it checked out. I'm like, why are you in urgent care? It's been 5 or 6 months. Your appointment. There were 6 or 7 people who came in with that level of acuity. Like, you don't belong in urgent care, right? And the wait time, of course, was extraordinary, right? This is private. So, this causes successive backups. So we have a healthcare delivery system that, because people aren't having facilitated access to the right care at the right level at the right time, they're jumping and clogging up higher acuity care. So that's exactly why we don't want people to wrongly get an ALS ambulance, because they're taking that ambulance out the street for somebody else, and we don't want them in an ED when they don't need to be. And it's a cascading impact. So what happens is you might think, well, that's just that one particular impact, but it ends up becoming exponential in its system-wide effects. So the hope with something like nurse navigation, right, is okay, let's help this person actually get that appointment, but that's only as good as your throughput to be able to do that. So one of the reasons it's taken a long time to get the pilot going is to make sure that there's the right linkages with actual clinics to be able to try to get people in and schedule for.
Thank you.
Javin?
James, thank you. I mean, I don't envy you, the work that you're doing. It's an amazing amount of work you're doing. I was curious, there's a $12 million budget that you're running. Is that just the medical stuff, or is that the entire county?
$12 billion budget is the whole county. Yeah.
So that's the whole county. How much of that goes to this medical stuff that you're talking? And what are the priorities with the county as to who gets more money than the hospital services? And how, and do we need to do anything about changing the priorities of which district gets everything?
This is a 3-hour question. I'll give you the short version.
Wait till the answer, you could have.
So the county budget is really multiple different things, right? So we are, one part an entity that delivers state services at a local level that are state directed and state funded. We have some departments, like our Department of Child Support Services, is 100% state funded. So whatever the legislature allocates, that's what that department gets, and that's the service that department delivers. We have our hospital system, which is a huge portion of our budget. It's about 40%, over 40% of our entire budget. is the whole hospital system. But most of that money is revenue that the system brings in. So about 88 cents on the dollar of our entire hospital system's operation is revenue brought in by the system itself. We have other parts of our county organization that have dedicated separate funding, right? Roads, parks, there's a charter fund that sets aside a specific percentage that's allocated to parks. Our discretionary revenue comes basically from property tax. So unlike cities, it's almost 100% just property tax. It's sales tax is really de minimis for us. And that property tax goes to fund all sorts of so-called, discretionary functions. But let me name some of the discretionary functions. The jail, district attorney's office, the public defender, probation. Well, those are gigantic departments. What's in common with all four of those? They're all mandated, right? They're all mandated. Things like a state mandatory maintenance of effort obligation that's imposed by the legislature to fund the courts to the tune of about $50 million a year. We're just required to write a check on over there, right? So on the one hand, we have this incredible $12 billion budget, and we're really fortunate as a community to have robust property tax base and be able to offer services that other counties can't. And on the other hand, so much of the county's budget is locked up in certain very specific ways. I'll give you one other example. Our public health department, which is a general fund department, a majority of its funding comes from dedicated federal grants, series of federal grants that are very specific on the programs that are to be operated, which is a huge challenge because some of those programs were created by Congress in the 80s, and they don't reflect our current community needs. They don't reflect the judgment of our public health department's leadership and what they think is the highest priority. But their only option is to take that grant and do that service, or to not take that grant and not do that service. But they can't take that money and do something else. It's a majority of our public health department's budget. So it's a complicated equation.
I guess what I'm trying to get to is, as a cities association, is there anything we can do to, get priorities, help you out? Solve those stuff or not, and maybe do some lobbying, do some action.
And Javed, we're gonna wrap up with that question. Thanks for reminding us again of that question. Any other questions or comments for James? And James, we are very familiar. We lobby every year against these unfunded mandates.
Yes.
So we get it. Perfect.
So thank you for your presentation. That was really informative. So I know that the cities have been impacted in the food service, ambulance, and again, you said you had a beautiful contract, but again, get what you paid for. You said you had a contract back in 2011, you had all this, but now, the pilot program that we're planning to implement, I think we need to start thinking about different ways how we can cut, how we can be more efficient.
Mhm.
And I really like that pilot program that you're talking about. Yes, but then again, that goes back to our dispatchers. So my question to you is, we have an ambulance in our city, and I think Santa Clara, City of Santa Clara has two. So when an ambulance is not coming, then we transport that patient to the hospital, we don't get reimbursed. So is there gonna be, from my understanding, is there going to be some type of reimbursement process?
My understanding is when that happens, you're able to bill for that transport.
Oh, we are, okay.
Yeah. So, the challenge with that model, and I know that that's happening here and there across the county. The challenge with that model is, we have parts of our county where the payments, right, where the people are being transported, all have private insurance. And we have parts of our county that have very different payments. For the system to function as a whole, you can't balkanize the system lest you basically get a system that is providing one level of service for folks who have private insurance and a different level of service for folks who don't. So, we're very mindful of the need to have one equitable countywide system that's delivering appropriate service across the county. And not a kind of balkanized system. So I know that there's a few fire agencies that have entered apparatus and service to deal with the current issues. But it's not a good model in the long run for our community as a whole. It's a really bigger picture destabilizing model for the county as a whole.
Yeah, I agree. I mean, it'll cost us, our cities more.
Well, for some cities, candidly, there's probably some cities around the state that would do that with big profit. But that's not something that's gonna be good for us as a community overall.
So thank you, and I think we're going the right direction. You're going the right direction.
There's a lot of work to do, and it's been, we're gonna need to continue to collaborate really closely with all of you. I've met with several of the city managers, with the fire chiefs, with the hospitals, and there's a lot of important stakeholders that have different parts of the equation here. And we're gonna continue to work with folks.
So I just have a comment.
Yeah.
And it's a bottom line comment. Basically, I think that your estimate of over 100% more in terms of services being needed by the county, I thought that it would be more like 300% instead of 100%. And you said that you didn't know why. So I'd like to offer you some rationale for that. And I think it's based on financial stress of all the residents in the county because of their living costs, the fact that they're working 50 or 60 hours a week, the fact that some people are not insured or not adequately insured, they have to wait before they could get into that emergency room to get those free services. I think that you have an issue with more traffic in the area so that as these services are replying back to where they need to get their patients, they have to go through traffic. So there is some idea here that urgent care centers in more localized areas would be better. And I do like some of the answers that you've given, but the bottom line is that people are stressed. And they're stressed financially, and it could have to do with the cost of housing in that area. So I don't know what the city's association can do with that, but if we can reduce the level of stress, then your numbers may look better.
I think there's no doubt we're more stressed as a community overall. So.
Thanks for that, Rachel. Any other questions, comments for James?
Okay, I do have one more.
Okay, Carmen, last one.
How much do we pay, the cities pay into that pot for the ambulance services? Does it depend on the size of the population of the city or?
The city don't pay anything for the ambulance service. Zero, no.
So yes, so can I remember?
Yeah. In fact, it's the other way around, which is the ambulance provider provides funding towards the fire agencies for first responder service.
That's something that probably need to be educated on.
Yeah.
Thank you.
And to follow up, because of course we have representatives from all the different cities, not necessarily here today, but that's the Cities Association. If a resident in any of our cities were to call the emergency services, they would respond. Is that correct?
Yeah, so if you call 911, this is true across California. You call 911, it first goes to your primary answering point, which is always law. So whatever the local police department is, they get the call first. They're gonna ask, is this law, fire, or medical, right? And if it's a fire or medical emergency, the call will get transferred to the fire dispatch center. Sometimes that's the same center, sometimes that's somebody else, right? So let's say you're in Campbell. Campbell has their own police department. It goes there for law. Campbell's fire department is county fire. So if it's a fire, call then moves to county communications because that's the dispatch center for county fire. So they then will handle that. But that center will do any emergency medical triaging. If it's a fire medical call. Fires in our county, there's contracts with all the fire agencies to be first responders to the incident. And then county communications centrally for all of those, except with the exception of Palo Alto, because Palo Alto has a grandfathered unique arrangement. County communications does the ambulance dispatch everywhere in the county to actually send the unit. I'll give different examples. Take Cupertino, which contracts with the sheriff's office for law. So when you dial 911, the call goes straight to county communications because they do the dispatch for the sheriff's office. So it'll all stay right there in county communications. But it's possible, let's say you're in San Jose, they have a separate fire dispatch from their police. They're physically separate dispatch centers. So you would first go to SJPD. They'll transfer to the fire department. Fire department's responsible for the emergency medical triaging. County communications dispatches the actual ambulance. That's the structure across California for 911. If you're on the highway, it goes to CHP, anywhere in the state.
No, that's very helpful. Thanks, James. And so to wrap up your presentation, and thanks again so much for being here. How can we move forward and partner with you? How can, our city managers are here. How can we work with you and help you with this effort? Because obviously, ultimately, we all want to serve our communities together.
Yeah, I think there's several things that you all can do that would be really helpful. One is to be, supportive of these pilot initiatives. I think there's always resistance and reluctance, whether it's from, fire chiefs or others to kind of new models. And we really are trying to explore how we appropriately triage right across the system. And so it's the same, request I've made to the hospital council and others, but I make to cities to be good partners in that. And relatedly with the dispatch centers to really make an effort to triage those medical calls. It gives us much better data for one, but it really has these cumulative system benefits. And that's a very concrete thing that's fully within the control of those dispatch centers. And then, we will be reaching out as we look at kind of what this means for the whole system and gather that data, and, you'll hear more from us. But, we do want to hear if there's problems or concerns with what's going on. But we know the big picture concerns, right, about paramedic shortage and whatnot. But if you're hearing specific things, like I heard, Mayor Klein mentioned, Sunnyvale, we know has a unique structure and setup. There were some specific issues that popped up there. We were able to follow up with AMR to get that addressed. So we are trying, we are holding AMR accountable for what they can reasonably deliver. We can't have manufactured paramedics, but if we get those concerns, we can do something on them. So make sure that your city managers, if those issues are arising, are reaching out, to my office. Steve's a great contact. Nick is here and he's happy to hear those things. But they should reach out to county staff so that we can address that. Our EMS agency isn't the service provider, it's the regulator. So they oversee that contract, they oversee the regulations, they promulgate the policies, they do the credentialing. So we need to know if there's compliance issues so that we can hold them accountable and impose liquidated damages, even though that's not what we want. At least we should get that, right? And things like that. So those are some very concrete things that you all can do.
Thanks, James. My second vice president here asked for 10 more seconds, and thanks to Mr. Preminger, we are going to continue the 988 service item to our October meeting. So that gives James 5 more minutes. Just give us an update on regional matters that you think will be important for us to hear. And so Tina and then James can give us the 5 minutes overview.
Thank you. I'll take 10 seconds. One thing we can help with is educating the residents.
Yeah.
So I heard numerous pilots, 911, how do we make a call? I should have gone to urgent care when I broke my toe, using that as an example, because that's true. But I do know 1/3 of my residents in Saratoga are seniors. When they are calling, if they have a better idea if I know, I can share with them.
Yeah,
First thing you pick up the phone, you say X, Y, Z, because that's all. We
Yeah.
can help with education awareness. That's the
absolutely.
bottom
We
line.
have, we have materials on, when should you call 911? You guys were gonna talk about 988. When you call 911, when you call 988, right? That's a whole big education campaign. And so we do have materials that we can provide that are helpful for those efforts, and using your communication channels to amplify that is always.
So that would be great suggestion, Tina. Thanks. So 5 minutes, James, regional issues.
Sure, so there's a lot, of course, going on, across the county organization, but one of the biggest things that I wanted to make sure was on all of your radar is the fact that we're in the process of trying to acquire Regional Medical Center in East San Jose. Regional was one of the 3 trauma centers in the county. It shut down its trauma services as of August 12th. Also downgraded their stroke and STEMI or heart attack services at that facility. Regional was one of the busiest emergency departments in the whole county, serves a very vulnerable part of the community, very diverse part of the community, with a patient payer mix that actually is very similar to the county system, meaning it's predominantly Medi-Cal and lower income folks, pretty high percentage of uninsured patients, and served as the catchment area for trauma cases for all of the east side and Milpitas, but also all the way down to South County. And so the continued degradation of service at Regional has posed some real bigger picture challenges, and it's been happening for years. In 2020, Regional shut down labor and delivery services, for example. That pattern was kind of on that trend to continue. Regional's owned by the same company owns Good Sam. It's HCA, the largest for-profit healthcare hospital corporation in the United States. And they're in the business of, I really don't mean this, to be snarky or anything, but they're in the business of running profitable hospitals, right? They're a for-profit company. Their job is to make money. Regional is not giving parents a hospital that they can run. But it is an important community asset. And so we're looking to integrate it with the rest of the county's health system. It's a big lift for us, especially a big lift given that the county's overall fiscal situation is very different today than it was in 2019. We just closed a very large general fund structural deficit. This first budget was county executive. Lucky me. And we're facing projected several years of additional shortfalls. So it's a big lift, but I firmly believe it's the right thing to do for the community overall. And it has ripple effects across the whole county, because when you have a hole open up with a trauma center in one part of the county, it contributes to backups, backlogs, and access challenges across all of the remaining 10 hospitals in the entire county. And that was especially going to be true for Valley Medical Center, which is the next nearest hospital, and is already the busiest hospital in the county. The level 1 trauma center, pediatric trauma center, already full, already very badly impacted ED. We don't have the space to physically expand easily on that footprint. And certainly would cost, well over $1 billion to try to do so. So those were some of the reasons behind the acquisition. We still have a lot of steps to go through. There'll be a public hearing at the Board of Supervisors on the 24th of September for the board to consider granting the delegation's authority to proceed with the approval. We're still needing to negotiate the actual purchase agreement with HCA, which, as you can imagine, is a fun task. We have due diligence and other operational pieces. And then we have, a whole host of other related challenges. But it's something that should be on all your radars, which is a very, very big thing. It's a huge lift for our organization. It's a big lift for a lot of people in the health system. We're still trying to recover from the exhaustion of the pandemic response, which, you know, they were working 24/7 on for years. But we felt like we needed to do this. So wanted to share that with all of you because it's sucking up a lot of our attention and focus as an organization. It's a lot of resources, but in the long run, it's gonna be put us in a position of strength as a community. There's lots of other things happening in this county organization. We are facing, like I said, another budget crunch. We are very worried about the state's budget because of the interrelationship there. And one topic on that point that you all have been great on, and I just want to thank you, but it's going to come up every legislative cycle, is this issue of excess ERAF funding. And I know it's come up with you, and I've raised it with the managers, and you all have been very supportive with our delegation. It's a very easy target for the state to grab our money. We beat it back this year. That was fantastic. We made it our #1 priority. We worked real hard. I guarantee you they will try again next year. Guarantee. It's too juicy a target for them not to try. So we need to be prepared for that and not forget this. So that's something that affects all of us. So wanted to make sure to mention that too. There's a lot of other things going on I could talk about if I had, you know, more time related to criminal justice system, related to, you know, we can touch on all the housing stuff, which I know is a hot topic for all of you. But you can rest assured that we're a lot of good work that continues to go on in the county, and you know, we appreciate all the partnership. You know, sometimes it's challenging and difficult, but you know, we serve the same people. Right?
No, thank you, James, and we'll definitely have you back. Because we really appreciate the partnership, working with the county and your leadership there. So thanks for being here. Look forward to continue working with you, not just the rural metro, but all these other issues you've got. So thank you so much for being here. Any public comment on this item?
No.
Being no comments, we'll close this item. Thank you so much for being here. Nice to meet you. Welcome to the county of Santa Clara.
Thank you so much. It's great to be here. And holding my business cards behind in case you guys want to reach out, please do. If you have any challenges, issues, concerns, we are more than willing to hear them and just want to help them.
And we'll follow up on getting the materials because to Tina's point, we have direct connections with our residents to actually get them the materials as opposed to having them go to websites and try to figure it out on their own. So thank you. So we're gonna move on to item number 4, which is the mental health update. As I mentioned, thanks to Mr. Manager. We're continuing item A, but we still want to do the resolution on recognizing September as National Suicide Prevention Month. You know, mental health has been a priority for us as an organization. And so we wanted to continue to focus on mental health by recognizing and adopting this resolution as an organization. So I'll quickly read it into the record and then I will look for a motion to adopt it as an association. So it's resolution number 2024-004, resolution of the Cities Association of Santa Clara County, recognizing September as National Suicide Prevention. Whereas the Cities Association of Santa Clara County Board of Directors voted on January 18th, 2024 to include mental health as one of its priority focus areas for this year. And whereas the Cities Association launched its mental health awareness initiative in June 2024, and whereas suicide is the 10th leading cause of death overall in the United States, the 2nd leading cause of death for ages 24 through 34, and the 3rd leading cause of death for ages 15 to 24. And whereas according to the Centers for Disease Control and Prevention, there are an estimated 1,300,000 suicide attempts each year, resulting in nearly 45,000 deaths each year in the United States, meaning an average of 123 suicides each day, or that one person dies by suicide every 11.7 minutes in the United States. Whereas the suicide rate in our county was 9.5 deaths by suicide per 100,000 residents. And whereas the stigma associated with mental health conditions and suicidality works against suicide prevention, by discouraging persons at risk for suicide from seeking life-saving help, and further traumatizes survivors of suicide loss and people who with lived experience of suicide. And whereas according to the CDC, suicide results in an estimated $70 billion each year in combined medical and work loss costs in the United States. So whereas September is an appropriate month to designate as National Suicide Prevention Month, because September 10th is World Suicide Prevention Day, a day recognized internationally and supported by the World Health Organization. Now therefore be it resolved that the Cities Association of Santa Clara County is committed to the following actions. Recognizing suicide as a serious and preventable national, state, and local public health problem. Supporting the designation of September as National Suicide Prevention Month. Declaring suicide prevention as a priority. Acknowledging that no single prevention program or effort will be appropriate for all populations or communities because there's no single cause of suicide. And supporting strategies to increase access to high quality mental health, substance abuse, and suicide prevention services and substance use disorder treatment. And with that, I look for a motion to adopt this resolution on behalf of the Cities Association.
So,
Oh, I'm sorry, I didn't get you moved it.
Public comment, so we have the motion by Javed, seconded by Sheila. Before we do the vote, let's check if we have public comment, and I see Mr. Pemberton.
Yes, I attended a suicide prevention conference all day today. It was held in Morgan Hill. Mark Turner actually gave the welcome. But in all seriousness, it was a very comprehensive discussion with a lot of different information shared about what we can do about it. And it was noted at the conference that every one of our cities has taken a position against suicide. And I think the presentation that we'll now hear next month about 988 will be very heartening. You'll hear all the different programs that are in place for people to seek help. So I'm so happy to see you doing this now.
Thank you, Steve. And so, if no more public comment on this item, we can do voice vote.
Motion to adopt resolution 2024-004. Recognizing September as National Suicide Prevention Month by Elahi, seconded by Mohan. All in favor?
Aye.
Any opposed? Any abstentions? Motion passes unanimous. Thank you.
Thank you, and we'll see if we can get this published. So thank you. Moving on to item number 5, which is the BCDC presentation, the San Francisco Bay Conservation and Development Commission. We've been waiting to hear from them. That we're happy they're able to make this meeting. And so with that, I do want to introduce our guest speaker representing BCDC, and we also have the mayor of Mountain View, who also sits on the BCDC board. So thank you both for being here. And with that, I will turn it over. Is it Jessica?
It is. I'm actually gonna turn it over to BCDC's executive director who's joining
Oh,
us.
so Larry is with us. Okay. Oh, great. Okay, Larry, thanks for being here. I didn't realize you're on Zoom. And so with that, I'll turn it over to your team.
I appreciate it. Can you hear me?
Yes.
Good, cool. What do you know? Technology works. So thank you very much for having us here. I want to apologize for not being there in person. Professionally, I'm really missing this because I love talking with mayors because I was raised professionally by a big city mayor. And personally, I would rather be with you than being at the end of the dining room table next to a pair of crutches and a leg brace due to knee surgery 3 weeks ago. So I'm going to hand it over to Jessica, and I'll be here to kibitz if you need questions answered or comments made afterward.
Larry. Good afternoon, everyone. My name is Jessica Fain. I'm the Director of Planning at the San Francisco Bay Conservation and Development Commission, BCDC. I have a presentation and I'm not sure the best way to show it.
You can allow me to share screen?
That would be great. Yep.
Okay, try it. You can try it now.
There we go. I'm going to be speaking today a little bit about a different type of an emergency than you've been hearing about today. A slower moving emergency, but an emergency nonetheless, part of the climate emergency that our world and region is facing, and specifically about our bay shoreline, and sea level rise. So I'm going to be talking about a law that was passed last year, SB 272, what it requires, what it means for cities and counties around the bay and around California, and some upcoming actions that BCDC is taking that you should be aware of, and know what's coming as we kind of move into the fall. So for those of you who don't think about the bay like I do every day, you might not realize that our bay shoreline is at risk. The bay is actually a third of the entire California coast, if you think about it, all up and down from Oregon all the way down to Mexico, and 1/3 of that shoreline is here within San Francisco Bay, but 2/3 of those economic impacts are going to be felt here in the Bay Area because of our unique geography, how we've developed our shoreline, and what's at risk. We also know that I had a lovely drive here through the hills on my way in here today, but the impacts of sea level rise are going to be felt by everyone in the Bay Area, not just those who live along the shoreline. These are some of the statistics on based on analyses we've done of the number of highway vehicle trips that will be impacted, the number of housing units, both existing and planned, that will be impacted, our socially vulnerable residents, our wetlands, our infrastructure. We've also worked closely with our colleagues at MTC and ABAG to develop some estimates of the cost of sea level rise adaptation. The numbers are large, so when you look across the region of some of the projected levels by mid-century, thank you, we estimate that it can cost approximately $110 billion to adapt to this risk as a region. But we also know that the cost of inaction is far greater as well. Here's a map of Santa Clara County. This just shows some of the projects that are already happening here or planned within the county. There's some really great efforts going on, South Bay salt pond restoration projects, as well as numerous other kind of activities across the county to try to address this risk. Some of these are planned, some of these are in process, but we know there's a lot more work to be done. So last year, Governor Newsom signed into law this new bill, SB 272. The law mandates that local jurisdictions across California in the Bay on the outer coast develop sea level rise plans. And it requires that BCDC for cities around the Bay develop guidelines for what those plans should include. It requires BCDC to review and approve or deny those plans based on consistency with these guidelines. And then cities who complete these plans will receive prioritized state funding for the projects contained within them. The law also requires that BCDC adopts these guidelines for what should be in these plans by the end of this year. So that is why we've been really busy trying to get these guidelines developed. So why do we need a plan? Why do we need a regional plan? There's a lot of work already going. Well, as a regional agency and a collection of cities all clustered around one bay, we think it's really important to have coordinated adaptation. We want to make sure that what one city doesn't inadvertently push water to another city or make things worse in another place. We know it's important to prioritize resources to our frontline communities, think about the health of our wetlands, to strategically implement our projects. We don't have $110 billion for this, so how do we decide what to do next? To create some commonalities and standards across cities, to think about that pipeline of funding and to track and measure. So we've been working hard over the last year or so, working with folks around the region to try to develop this plan. We've been very thankful to work with several elected officials within Santa Clara County. Commissioner Showalter has been a wonderful champion of this issue at BCDC, and as Mountain View Supervisor Lee and his alternate Yuriko Kishimoto also sit on our commission, as well as Commissioner Burt. We also have been working with a local elected task force of representatives from around the region Councilmember Sell and James from Sunnyvale. So where do we start? We start with a vision. What do we think the bay should look like in the future? What should we think our new shoreline should look like with more water in it? So we started by working with folks around the region to craft this vision. I'm not going to go through it in detail, but it touches on many aspects of what make our communities tick: our health and well-being, our critical infrastructure, our ecosystems, our housing, our public access areas. And so coming from this vision and what we're working on right now is this shoreline adaptation plan. And so by the end of this year, what we're going to be releasing is this vision. Based on this vision, a set of strategic regional priorities, and then guidelines for your cities to follow as you create these sea level rise adaptation plans. After this year is where the real work begins. That's when cities have until January of 2034 to complete these plans according to law. So what's in these plans? This is what we're developing right now. What is going to be required of cities and counties? We've been thinking about the scale of these plans. Should it be every city? Should it be at a county level? Well, the law requires that every local jurisdiction, cities and counties, have one of these plans. But we also really think it's important for cities that are next to each other to be working together. So we're really encouraging counties to kind of take a lead role to bring together their jurisdictions to work together on these. But we'll accept county plans, in some cases, single jurisdiction plans, and really encourage those multi-jurisdictional plans. What's in the plans? Importantly, we want you to think about the vulnerability of what's at risk on the shoreline. We want you to come up with adaptation strategies. We want you to think about your land use plans, your general plans, your land use patterns, and how they integrate sea level rise adaptation into them. We want you to think about how you'll implement these plans, and we want you to provide us with a project list to help really think about what's most important for you. We also have been thinking about what the process is to submit these to BCDC, and so we've developed a process that allows jurisdictions to create these plans and then in a transparent and coordinated way bring them to BCDC. One of the things that's really important are some of these standards. How do we kind of standardize this work across the region? Sea level rise is right now, it's kind of up to each city to figure out how to think about these risks. So we've been creating some standards around the types of sea level rise projections. We have statewide standards. We're giving instruction for how to use those standards. Some standards around the types of things we want you to look at. Some standards around equity and how we make sure that all communities can really be part of the process, as well as standards around how to do adaptation. So it's been a lot of work, but we're really sort of at the beginning now of really releasing this plan for public comment. Today, we will be releasing the draft of this plan for public comment in a 5-week public review period. We're going to be hosting some events during this public review period to really get the word out to folks. So we're doing a webinar on September 19th for the general public. We're partnering with League of Cities on October 7th to do a brown bag webinar lunch with all of the 3 divisions representing the Bay Area. At our BCDC October 17th public hearing, we're going to have our official public hearing where members of the public can come in person or remotely and give testimony in anticipation of the December 5th vote. 2 things to note. A lot of folks asked, is this an unfunded mandate? How are we going to do this? There is grant funding available to cities right now through the Ocean Protection Council. There's a link right there to the funding. It's a rolling grant program. It's not competitive, so as long as you kind of have all the things that are required, it's there. So I encourage folks who are looking for funding for this to check that out. There's even technical assistance to help support grant applications available. And then moving into the next year, as cities really need to create these plans, we're going to be working, we're really looking forward to partnering with cities across the region to figure out how we can assist you in developing these, so it's as easy as possible with really getting sort of at those big regional needs. So, I think that's it for me. Here's our website, my name and contact information.
You know, thanks, Jessica, and we will share this with our broader membership. I want to turn to Mayor Showalter as one of our council members who serves on this commission. Any updates for us and things that you think are even more relevant for us to know?
Well, I'm just, first of all, I'd like to also mention that Larry Klein is a very active alternate on BCDC. He's the alternate for Pat Burt, and I would say you go to at least half the meetings, it seems like. Anyway, and I've been on BCDC since 2016. I started out as the ABAG rep, and I was on it for a couple years, and then I lost my election and I lost my seat, but I kept going to BCDC. And the whole came up with the Senate Rules appointee, and I applied immediately, and they gave it to me. So I basically have been on BCDC since 2016. I was an environmental engineer for my career, and so I worked on the South Bay Salt Pond project for about 7 years at the Valley Water. So you know, this is very interesting professionally for me. But anyway, I would like to offer an invitation to everybody. As you can see, this is a really complicated conversation that we're going to need to be working on for many years together. And I would like to we have a county collaborative of staff members that is working on all sorts of climate resilience efforts. And a part of them are working on sea level rise. But there is not an elected group that is needed to talk about this. So I am going to start one. And I would like to invite elected representatives from at least each of the 5 shoreline cities to Mountain View City Hall on October 23rd. That's a Wednesday at 1 p.m. And we will have our first meeting. And I think from there we can get some background information on what is going on. You saw that quick map of what's happening in Santa Clara County. We can go into that a little more detail and talk about how we can work together. So the 5 cities are Palo Alto, Mountain View, Sunnyvale, San Jose, and Milpitas. Those are the shoreline cities.
This is great. Thank you.
No, is that all?
Not Santa Clara. No, Santa Clara, it's not within BCDC's jurisdiction. There will be impacts of sea level rise in Santa Clara. And so they're not subject to this particular law, but it is strongly encouraged that Santa Clara should be.
So of course, if Santa Clara would like to come, if other elected officials, like to come and represent your community, that's not. But I think it's particularly important that the 5 shoreline cities work together, because we need to make sure that the projects that we are planning for and building all work together. They need to work together physically, or we won't be protected. And as a civil engineer, I just like to tell you, this is really important. We need to make sure they all mesh. So I will be, what would be the best way to figure out who the rep would like to be?
Shelley can help us with that, Pat.
Okay.
And that's what a great idea. I endorse that idea of pulling together the groups from the 5 cities and anybody else who wants to join in this discussion, because as we said, we all need to work together on this issue. 2 things, and I see your hand, Javed. The Skyline College event I mentioned, I didn't say the topic, but this topic is sea level rise on September 25th that the Cal Cities Peninsula Division is hosting. And Assembly Member Papin and a couple other folks, someone from the Coastal Commission will be speaking. So I just remembered that and wanted to plug that as well. So we're going to look for questions, comments, either to Jessica or to Pat on this agenda item. And let's start with Javed.
I was just curious, some of the sea level cities, Santa Cruz and all those cities, are you guys involved with that? What's going on with that?
Those are on the coast.
Yeah.
And the Coastal Commission works with that. We work on the cities that are on San Francisco Bay.
Just the coastal, because they don't have their own city organization. roof like you guys have here?
I have no idea.
That's where the threat's coming from.
Thanks, Jonathan.
And
Lydia?
the coastal commission, BCDC's jurisdiction sort of goes to the Golden Gate Bridge, and so all the rest of the California coast is managed by the coastal commission. And they work with many of the cities.
Lydia?
Thank you. Mayor Showalter, thank you for the bringing together the cities to work on this together. So how about East Palo Alto? Because they're such a close neighbor to Palo Alto, and anything that happens to them might happen to us.
They're interested in coming short.
So, okay, thank you. And that's part of BCDC also?
Yes, yeah, and that's a great example of a place where cities need to be working together. The San Francisco Joint Powers Authority does a really good job of trying to bridge those counties and issues, but I think that's a great
Because
suggestion.
there's like Menlo Park, we're like three, Menlo Park, East Palo Alto and Palo Alto because of the creek. My other question was, so is Valley Water, because I'm a director over there also, and they are doing a lot of work on the levees and doing work to address sea level rise. How are they incorporated into this Bay Adapt, sorry.
Great question. The Santa Clara County, or Valley Water is a huge player, as is the Coastal Conservancy and U.S. Army Corps of Engineers in terms of the big entities that are very involved with the shoreline of Santa Clara County. This law requires that local governments adopt these plans. But we know it's really important that those special districts and other groups are very actively involved. So they will have to be at the table. They are the main entities that are working on this issue in the county. We've been coordinating with them. But in terms of the law, it's the cities and counties that need to adopt.
That's very interesting. Thank you for clearing that up because they're a big player in this. And I can't see them not being at the table. And then also, with Palo Alto, we do a lot of natural mitigation in order to address the sea level rise. Is that something that can be incorporated into a plan as well, or is gonna have to be
Yeah, we love natural solutions. One of our big pushes.
Gotta do those first.
We really want to try wherever we can do it. Let's restore wetlands. Let's try to think about sloped levees that are very gentle, can allow for habitat to be on top of them. That's our preferred sort of approach, but that's not going to work everywhere. There's some places where you do need a more structured.
Absolutely, yeah, because we have levee gates. And then we have the natural environment part, so good to know. Thank you so much. I was kind of worried when I was hearing, is it all going to be engineered seawalls or, the other kind of walls that go out directly into the water? I mean, so what happens to nature? Yeah.
Thank you. And that's what's great about this meeting. We learned so much about what's happening in communities and how we work together. I see your hand, Carmen. We're losing our attorney at 9, and we do need to do the professional services agreement with her here. And so if you don't mind, I'm going to skip your questions, see if we have public comments on this item.
None.
And so we'll close this item. Jessica and Pat, thank you both so much for being here. This was very informative, and we will follow up. And if you're available on September 25th, it would be great to have you at that lunch at Skyline College. So let's move on to item number 7, which is the professional services agreement for executive director. The agenda item describes what it is, and so let me turn it over to our attorney to introduce the item, and then we can move to discussion or possibly a motion.
Good evening. When we formed the JPA, the board made a determination that the contracts for the executive director should be in line with the fiscal year. So we're bringing before you this evening a draft agreement and need some direction on a couple of items, including the compensation amount, so that I can complete the agreement that will cover this fiscal year. And then hopefully next year we can do it in line with the budget. And the recommendation is that you approve the terms, which means actually provide me some direction on the compensation amount for the agreement to cover services provided by our executive Director Shali Surkey from July 1st of this fiscal year through June of next year, that you also authorize a budget amendment. That's included because the amount of compensation was budgeted at $120,000 per year, but we're recommending budgeting $130,000, which would include 25 hours of service per week from the executive director to make sure that that would cover, based on a rough approximation of the services that have been provided over the past year and a half, 25 hours a week of services with an amount of $130,000 for the contract. So there would be a budget adjustment included in the motion to cover that amount. And then I'm seeking or requesting that you authorize the chair or the president to execute the amendment once those changes are made.
Thank you, Jenny. Any questions for Jenny? If not, I will look. Were you gonna say something else, Jenny?
Well, just, and if there is a change to the $130,000 of compensation in the contract, and that was an amount in the staff report, let me know and I can make that adjustment when I finalize the contract as well.
Thank you. Questions, comments? If not, I will look for a motion regarding these. Oh,
I just had one thing that, if we discuss compensation with us, there's one other thing I wanted to see change in, or added to Exhibit A, not really change. Exhibit A is the one that defines the scope of services for the executive director. I want to add something because our executive director is unique because in the city association, we deal with all the cities. I'd like to put some affirmative duty on the executive director to talk to other city managers or provide them with information on what the city has done that the other cities need to follow up with or do something else. To have a general flow of information going back from the city association to this different cities and also encouraging them to get back to you. As far as to add that as one of the items of task that executive is supposed to do.
Great suggestion, but guess what, Jonathan? We already do it. Shall I describe what you do on a monthly basis?
But I'm looking at it.
You want it to be specified in the contract? Okay, because she doesn't.
So, but I would like to expand what Councilmember Alahi says, because right now I liaise to the City Managers Association. And I would also like to further liaise with other groups as appropriate within our county. I'm also trying to build a relationship with the organization in San Mateo County to see what they're doing and to understand some best practices for similar organizations. So I don't mind memorializing that in the contract. That's
I understand you do that, and that's very effective. But on a one-to-one basis, just an email or something saying, here's what the city association has done, which you send to everybody now, we read that. But it could also be addressed to the city manager for different cities saying, this is what you guys may want to follow up.
Okay.
So it's an email that just goes to the city manager association meeting is a more large meetings, a lot of stuff is discussed. But it'd be good to see the city association perspective through you going directly to each city manager so they can bail out of it.
Okay.
Jenny, and Javed, I think maybe that may require a more in-depth discussion about what we're specifically requiring. I will tell you that instead of reaching out to each city manager, Shali's already doing exactly what you're saying, but she does it in the room with all the city managers. She's not sending individual emails, but there are times I know she'll follow up if necessary with each city manager. But to your suggestion, I know Mayor Klein, who's putting a motion together, is gonna try to sum it up and get that language in the contract.
That's nice.
Okay. Any other questions, comments? Jenny, do you have any other comments before we look for a motion?
No, it is possible to, if the board so desires, to add liaison with the City Managers Association in the scope of services.
Yes, and Mayor Klein, who I think is gonna make the motion, is adding that as part of his motion. So let's see, are there any public comments on this item?
No.
Okay, so with that, I will look for a motion.
Sure. I move to approve the terms of the independent contractor agreement with Shali, with including these changes or undefined from the draft contract that we saw. 2% increase in salary for $102 an hour, and a $132,600 minimum maximum. Remove the automatic renewal language. Have the new contract retroactive to July 1st. Authorize a budget modification for increased salary for the budget maximum to $132,600. Authorize the president to execute the contract, and of course, add the action of liaison with the city manager association as one of Charlie's duties.
So with the motion, attorney, any questions on those items? Were they clear?
Very clear.
Perfect. Thank you. I look for a second. Second by Tina.
And I'll just make a few minor comments. As far as the automatic renewal, I think, you know, when we go to the budget next year, we'll be talking about this, and especially if there's additional definitions of any tasks that need to get done, that's something we can look at definitely. But I think this is, thank you for your service for especially during difficulties of COVID and coming on during that time, and how you've served this organization for very, so thank you.
Thank you.
So we'll do a voice vote. Yes, voice vote.
Can I
and then
ask
we'll-
a clarification question? I'm so sorry.
No, go ahead.
Yeah, so just want to understand, so for a raise of such, how does my city get involved in terms of giving the decision?
So it doesn't affect, this is within our budget, and so it does not increase your annual dues that we've already established.
Yeah, so that is internal, this is internal.
It's within the
business.
budget we have.
Okay, thank you.
But great question. So we have the motion, it's seconded, and we'll do a voice vote.
So for clarification, it will be annual review, it's not automatic.
Correct.
Yeah.
Yes.
So the motion as stated by Mayor Klein, which I didn't write every word of it down, by Mayor Klein, seconded by Councilmember Walia. All in favor? Any opposed? Any abstentions? Motion passes unanimously with my heartfelt thank you. So
We'll tell you that it was all positive reviews on the work you've done over the last couple of years, so a big thank you. We enjoy working with you, and we look forward to working with you for many more years to come, so thank you.
thank you so much.
Very efficiently.
Thank you. Okay, so we'll move to, we started at 7:15, so I'm guessing we're gonna go about 9:10, 9:15. Going back to item 6, I will only quickly cover proposition 5 because we've talked about the BAFA bond. Proposition 5 will be on the November ballot, and it's not getting a lot of attention, but it actually impacts our cities greatly. It relates to reducing the voting threshold from supermajority to 66% to 55% for housing bonds, infrastructure like police stations, things we care about, and we want to have a much easier time getting passed so we can have these things in our cities. This is actually one of the reasons why the decision was made not to move forward with the bond, because the polling was not very strong. And so this is an important measure for cities to pay attention to. Proposition 5, it's on the November ballot. Happy to talk about it more in October, but I wanted to flag it for council members. This will impact our cities. It's something that we need to be focused on and get involved if we're interested. Any public comments on this item? Seeing none, I'll close this item and I will move to item number 8, which is the nominating committee. The bylaws allows the president to form a nominating committee. As you know, the term of this executive committee expires in December, and we normally have an election in November, and the new executive committee is sworn in December. And so as a president, I get to form a nominating committee that will work on the process we will follow to select the new executive committee. I have asked Mayor Klein and Mayor Mohan to serve with me on this nominating committee. And so we will meet and you'll see an email that will explain the process, the different seats that will be open, the process if you're interested. So please look out for that email. The nominating committee will need to meet first, and then we will share the process with you so you can get engaged, and the election will be in. Any questions? And I looked at the bylaws, so I know we don't need a motion. I have authority to do this. So thank you all, and thank you, Mayor Mohan and Mayor Klein, for serving with me on this nominating. Okay, so then we will move to, I'm gonna jump to the Legislative Action Committee update. From Chair Walia, who I know has been doing an amazing job this past year. She's been very busy, and so the purpose of this item is to give us a quick update on what has been accomplished this past year. And what we're still waiting to hear about, I'm sure.
Thank you, President Flagler. So I'll be very brief. But I'm going to start with a thank you to both Shally, our executive director, and very big thank you to the board president, Lisa Flagler, who has done this job really well in the past. I couldn't have done it without the support of either of you. So I'll stay to not doing the whole year's review. We can do that in November, but I'll stick to what we have done in the last month. The August 8th meeting, the board took positions on two bills, AB 2513 Pellerin bill and SB 1130 Bradford bill. We have submitted position letters in support of both of those bills. In addition, we resubmitted position letters on bills that were still active in the legislature. The board had approved those position letters earlier, and we had sent those position letters in the prior months. So AB 1794 McCarty bill, AB 1820 Shallow bill, AB 1886 Alvarez, SB 1037 Wiener, and I also believe SB 21 Umberg bill. We submitted those letters. We changed the dates and we stated that we are sending them again to express our position on those. Lastly, there were certain hot bills that were flagged by CalCities, and I reviewed the list. I found there were 3 bills there that were similar to the ones that the board had voted on in the prior months. And as President Flagler just mentioned, our bylaws, even on this subject, they specifically say that we can send first advocacy letters if we have sent something similar with board approval in the prior months. So there were only 3 that rose up, and we sent opposing position unless amended for SB 937, that's a Wiener bill. It was similar to AB 1820 based on developmental fees. Secondly, AB 2023, that's a Quirk Silva bill. It had concerns, housing element review changes similar to AB 1886. And lastly, AB 3093, bill by Ward. It is again similar to AB 1886, and essentially the request was that we prefer that HCD works on housing element compliance and provide clarity to the cities versus penalizing. And Shally has been doing a great job working with Anthony from Los Altos Cities. Thank you, Los Altos, very much. And I am pretty confident that the Cities Association website will be updated with the addition of these position letters as well. And once everything has been signed, or whatever has been or not been signed by the governor by the end of this month in November, I plan to give an annual wrap up. Thank you so much. Great. Yeah, great.
Thank you. I'm guessing no public comment on this item. And so I'm going to jump back up to item number 9, which is the holiday party. Shally sent an email to city clerks and city managers, I think either early this week or last week, because we actually have 2 dates on our calendar for our annual holiday party. Traditionally, it has been on the same second Thursday that we have our meetings, but at least Cupertino normally has its reorg meeting the same night, and so we always miss our Cupertino representatives at our holiday party. So this year, at the beginning of the year, we decided to do something different and propose doing it on Friday the 13th instead of Thursday the 12th. We discussed it. I think we voted on it, but I learned from a couple of members that they didn't realize we had moved it to the 13th, and some people I think already have something Friday the 13th. So what we really want to discuss and hear from the board members tonight is, do we want to have our holiday party on Thursday, the second Thursday and maybe the Cupertino folks can join us after their party? Or are people still available and interested in doing it on Friday the 13th, which is what we voted on in January? I think we just didn't put it on our calendars. So really want this feedback because Shali and I and the rest of the team need to start the holiday party, and we need to know if it's gonna be Thursday the 12th or Friday the 13th. Thoughts?
You voted on it already.
Well. Any objection to having it on the Friday?
President Flighter, can I give
Yes,
you a little
sure.
bit of the results that I got?
Yes, please.
Okay, so I've heard back from 7 cities. And the ones that I've heard back from, no one has anything scheduled on December 13th, which is that Friday. Some cities do have the reorganization meeting, a commission meeting, a climate protection working group meeting. So there are meetings on some of the other cities on Thursday. And they start at 6 o'clock. 5:45, one ends and the other one starts at 6. So there are evening meetings on the Thursday. I don't know how many council members will actually go.
Okay, so we're going to do the 13th. We're sticking with the 13th. Who has, do you have your hand up?
They had Los Altos Hills had last year on the Thursday. Do you have a standard class like Cupertino?
Friday the 13th.
Right, it looks, because based on Shali's response, we're looking, so everybody, we need to, and Shali will send an email, we're putting it on our calendars, we're gonna plan for Friday the 13th to have our holiday party. And it's gonna be here in Los Altos, and we'll definitely be providing you information soon about where it will be, what it will be, and what we need you to do. So we have a date, it's confirmed, thank you all so much.
So we picked a lucky day, Friday the 13th.
Yeah, I know, maybe that will tie into the theme.
My request would be, if at all possible, to send a one-liner, save the date to all the cities ASAP.
I'll send a calendar invitation.
Yeah, something so that it's out there in the cities. It'll take you a while to put everything else together. The earlier the better.
Thank you. Okay, next we will move to item number 11, and I know I'm jumping around. To Mr. England, do you have a City Manager Association update?
Fortunately, that's the last meeting, so no update.
Okay, I think Steve was there and we also attended. So Steve, any updates from the City Managers group?
We had a joint meeting between San Mateo and Santa Clara counties, and we talked about getting ready for the elections that have to do with bonds on the ballots. And it was a positive discussion. The speaker was the woman, Catherine Liu, who many cities have worked with in the past. So it was a positive meeting and frankly, a great lunch.
Thank you.
Hosted by the city of Palo Alto.
Lydia, like really. Shali, your report, your update?
I actually don't have an update this month. I've been working very much on getting the membership dues in. We've got most of them. So I'm just following up with the cities that haven't.
We won't name names this one. Next month, I want to name.
Next month.
Assuming Los Altos is not on there. Okay, well, thank you. So last item, joys and challenges. Let's start with Lydia and just go around the room. Joys, challenges, anything you want to share that's happening in Palo Alto?
Everything's great.
Everything's great.
I'm good. Everything's good.
Oh, this is good. Joy, housing element, sealed, certified by the state, challenges the upcoming election.
Yes.
Saratoga, the council decided to cancel the election since we last met. There were 2 incumbents, myself included. I abstained from the vote. Both incumbents were qualified, nobody else filed paperwork, which was nice. So here I am happy to be serving out of the county, my city for the next 4 years. And deeply appreciate all the support from all of you. The work I have learned at the regional level goes a long way for me to serve.
Congratulations.
Yes.
2 quick joys. First, our State of the City is on the 21st of September. For those of you that visit City Hall, There's an amphitheater, so the amphitheater is open, there's new artwork that just went in for that, so that'll be a day, a morning starting around 9 a.m. of arts and music and of course speeches. If you can attend, you should have received something. I reminded the city clerk yesterday about getting that out to everyone, so hopefully you went out. And then the other big joy is we appointed our new city manager. He's been, Tim Kirby, internal, so he was our interim, but he's been with the organization for 29 years, showing that any staff member can work their way up from, he was working on a smart station to begin with and got into finance, director of finance, and ultimately now is our city manager. So it's great for our employees to see that pretty much anyone can be city manager if they put their effort to it. So it's good.
I just have an announcement to that. We would like to inform you that Mr. Steve Leonard is no longer required for the city of Montserrat. City Council has named Ms. Diane Perkins, the city planner, as the interim city manager. Effective immediately, the city of Montserrat will continue to focus on exceptional customer service and meeting the needs of the residents.
Thanks for sharing that announcement. When was that effective?
It was effective.
A week ago. Thanks for that update.
Sure, there's two joys, first of which is Los Altos Hills has no election. 3 candidates for 3 positions. $30,000 saved, thank you very much. And the second one is that I have attended the most wonderful, magnificent volunteer appreciation dinner just a couple nights ago at the Morgan Manor. We had 106 people. 13 committees, and we appreciated that. We just did one. It was so wonderful.
Two things, I won't repeat the election thing, but
Rub it in, just rub it in.
We hired an excellent city manager, town manager, who is Chris Constantine, who is former city manager of San Dimas and assistant or deputy city manager of Chico, and has a finance background, emergency response background. And we're absolutely delighted. He has roots to our community that go way back to when he was a teenager. So we're really welcoming him. He will start on November 4th. And we can't wait. The other thing is we are doing another workshop. This is again through our Thrives Foundation. It's called Los Gatos Community Center Design Event, and we're going to roll up our sleeves and start designing this new community center that we hope to have in the future. And I want to thank all of the cities that welcomed us to hang out in your community center so that we could steal ideas and learn, because we'll get one of these days.
Well, last weekend we had our Art and Wine Festival, which is where, you know, you can meet your 250,000 closest friends. And I think a good time was had by almost everyone. And then I guess another joy or challenge, depending on how you look at it, is the election. We have 4 slots open on city council and we have 9 people running. It's just a really talented group, which makes me sad. I mean, I think I'm one of the talented people, but it's like we're all talented. So, and then the other thing we have on the election is which actually is a joy. It's a property transfer tax, and so we have one, but it's very small. So we're increasing the amount, and if it passes, we think that it will produce about $9 million a year revenue, which we have so many needs for. But the joy along with it was that there was a group over the summer who got organized to oppose it. And because of negotiations that we were able to do about a resolution about how we expect to spend the money, they have withdrawn
Their opposition. Chair. Yes.
Is that
So
50% or 50%?
Our city manager.
Wait, John, follow-up question, simple majority to pass.
So my city manager just shared this, right? And actually, so we've received 2.9 million grant from the United States Department of Transportation under the Safe Routes to Schools program to retrofit intersections in schools and along school routes.
No, congratulations, it was a road.
The Biden.
Yeah.
Oh, yeah, Biden.
You. I'll quickly share a joy just on the mental health theme. Mayor Mock and I were able to attend a tour of Alcove, which is a mental health facility in Palo Alto and Middlefield that the Santa Clara County fully funds. It serves the entire county, even though it's based in Palo Alto. We did the tour with Supervisor Simitian. It's just a wonderful place that we want to make sure residents are aware of.
What's the name of the
Alcove. Yeah, alcove, like all cove, that's what it's spelled. It's a really nice facility and it's for ages 12 through 25. Yeah. Yeah, all covered by the county.
All these therapists.
Yeah, it's really great.
Wonderful.
Really great. And it's expensive.
They have.
Do you remember what the capacity is? They're definitely not at capacity, and that's why Supervisor Simitian wants to make sure that this wonderful resource is available.
25 per day, they currently have 15.
Are there any overnight beds?
No.
It's a drop-in facility. There's one in San Jose also.
Oh,
Alcove, yeah.
So with that, thank you all so much again for being here and coming early. We will adjourn our meeting at 9:20 p.m. Thank you.